Hello and thank you for coming today. My name is Akam. I'll be presenting on race and ethnicity-based bias in bedside nursing notes. A little bit of background of how this project came to be. It's well known that clinician notes in the electronic medical record are important and they communicate vital information on patients and their care. There's been research that shows that bias can be transmitted between healthcare workers in simulated clinical documentation, but there's been very little research or data on identifying implicit bias in the true electronic medical record. Nursing notes for inpatient pediatric patients frequently include information on the patient's bedside companions, including a subjective descriptor. We hypothesize that race and ethnicity-based bias exists in pediatric notes and can be identified by studying the descriptors used for bedside companions. We further hypothesize that white patients, compared to racial and ethnic minority patients, have a higher percentage of positive descriptors used. We examined the electronic medical records for all patients less than 18 years old who were admitted in the year 2018 to the general pediatrics, NICU, PICU, and nursery floors. There were greater than 26,000 individual encounters, meaning nursing notes. We excluded encounters that directly mentioned DCF or DCS involvement because we thought that this would potentially predispose to bias. We also excluded encounters for patients without a known race. This resulted in a total of 22,000 notes corresponding to almost 1,800 unique patients. The encounters were then manually reviewed and coded for valence, either positive, negative, or neutral, by a single individual blind to the patient's race. Because there is some subjectivity in deciding the valence, having a single reviewer allowed for there to be more consistency throughout. And here are examples on some of the positive, neutral, and negative descriptors that were used for bedside companions. Subsequently, analysis was performed using chi-square goodness of fit test to assess for the differences in proportions of positive versus negative or neutral encounters by race. And because we hypothesized that there would be very few negative encounters, we a priori decided to combine negative and neutral encounters. These are results that show the various encounters broken down by race and valence. And as you can see, our hypothesis about the number of negative encounters was correct. There were very few of them. The chi-square test showed that there was a significant difference in the proportion of positive versus negative or neutral notes. In order to better understand where this difference was coming from, we performed a post hoc analysis with adjusted residuals for positive valence. The way to interpret these results is that the adjusted residuals tell you how far away from the expected proportion of positive notes we are. And so the more negative an adjusted residual, the fewer positive notes there are. The more positive the adjusted residual, the higher the proportion of positive notes there are. As you can see here, we have a significantly reduced number of positive valence notes for Black and non-Hispanic other patients, and a significantly increased proportion of positive notes for white patients. So what are our conclusions from this study? First of all, this was a proof of concept study that bias can be identified in real-world clinician notes, and there is a framework for how to do so. We also concluded that pediatric clinicians exhibit positive bias towards white patients and their companions, which was expected. And ultimately, we concluded that more studies are needed to understand if this bias is transmitted and what effect it has on patient care and outcomes. Thank you very much for your attention. If you have any questions, feel free to email me at the email below.